One theme that we've had throughout this whole crisis is to be sure that we were being prepared and that we can instill confidence in you, our citizens, to alleviate any sort of panic. And so there'll be some remarks by myself, County Judge Downing Bolls, followed by the CEOs of both Abilene Regional as well as Henry Medical Center. Also, Dr. Lowry will also say some things, Chief of Staff at Henry Medical Center, and then Robert Hanna will talk in regards to enforcement. This morning, 400,000 Americans were infected by this virus. And throughout the country, there's almost been 13,000 deaths. Instead of Texas, and Texas fared a lot better than most, we had about 8,200 infections in the state and about 154 deaths. West Texas has done better than most of the state. Amarillo, Midland, Odessa, Abilene, Wichita Falls, there are 436 infections, and there have been 10 deaths. In Abilene, as of yesterday, we had 38 infections, and we had 1 death. We just wanted to be sure that you knew that we were working on behalf of you. So every day, myself and the judge, along with City Manager Robert Hanna, and Judge Pro Tem Chuck Stadler have conversation, sometimes on the phone, but always every day, including weekends, to be sure that we are abreast. But not just the 4 of us having conversation. We engage with the medical community, and they'll provide some very pertinent information, but also our representative, Stan Lambert, as well as Jody Arrington. And by the way, Jody Arrington, our congressman, is working this morning with Vice President Pence in regards to providing healthcare equipment for both Lubbock and Abilene and those in the district, as well as assisting and streamlining SBA loans for the business community. All hands are on deck. A couple of different things, and I'll let both Mr. Murphy as well as Mr. Holland speak to this, but we've been reflecting the last week in regards to the ordinance that we have in place. And I think what you'll find is that it is working and having a very positive effect, but we can do better. One thing that's problematic is we have too many of our neighbors that are not following guidelines in the order or guidelines from the governor or CDC, and we have to be better. In a bit, Robert Hanna will talk about how we may encourage you, our neighbors, to be better. I will leave with these thoughts. We will have, the city will have to make a modification on an order that expires next Tuesday, and we will do so. But when we do so, we'll do so in conjunction with the county judge and his input, as well as all of the aforementioned partners. We're going to be okay. This will end, but we may see things worse before it gets better. But know this, that we are prepared and we are ready, and we're working for the betterment of your community, of our community. So next will be County Judge Downing Bolls, followed by both Mike Murphy as well as Brad Holland, and then Dr. Lowry. Then Robert Hanna will come up and talk about enforcement. Downing?
All right. Thank you, Mr. Mayor. I'm going to take this down so that people can hear me. If I don't, you'll barely be able to hear what I have to say. But I wanted to take this opportunity to just once again talk to the citizens, let them know that the county is functioning. We're up and functioning. We're doing it in a different way, but we are using distancing and keeping our folks in a room down to less than 10. And so it's created a different way of doing things in the county, but it can be done. And we're just here this morning to let you know that we are continuing to work together with the city as we put these plans in place to try to protect our citizens and, of course, continue to function as normally as we can in the very unusual times that we live in. We do know that this COVID virus is spreading through our community. All you have to do is look at the numbers at night before the newscasts start, where they put them on at the very top. You can see the numbers are going up, and that's how we know that it is. We're not getting better, we're getting worse, and will be for a while until this thing reaches its crest, and then we'll start to fall after that, we hope. So again, we'll hear more from the doctors about that in just a moment. One thing I did want to talk about this morning, we've had lots of phone calls from folks wondering about the jail. They're quite upset that they can't visit friends and loved ones who may be in jail. The jail is operating with a no visitation policy, as is the Juvenile Justice Center. That's for a reason. We are protecting the inmates there in those facilities, as well as the citizens themselves coming. And the jail staff. The worst thing that could happen is for that stuff to move into the jails and the places where it is a very enclosed community. So we're taking the steps that are necessary. We know and understand that you're frustrated by all of this, but this is a situation that has to be taken for the protection of everybody. One other thing I wanted to talk specifically about this morning is elections. We have canceled the elections in Taylor County for May the 2nd. These are not county elections, these are municipal elections, and they're within the authority of the cities to put those elections in place and to conduct those elections. By and large, most of the places who were planning on having those municipal elections on May the 2nd have agreed not to hold those elections, but to delay them at a better time for holding them. We still have one or two that are still talking about holding their elections. We're working with them, but we have acted under the governor's authority to go ahead and move those elections to a later date. We don't have a date set yet, but we are going to move them and not hold them. At least the county is not going to participate in those. We do, under contract, provide election services for the municipalities in our county. The governor has given his directives that it is his belief that holding elections would put people at danger because it puts them in a small confined place, which would be a polling station. It puts the poll workers at danger because they will be in direct contact with people who are coming in to vote. And it puts the voters in jeopardy because they, again, will be congregating in one location. I can tell you that in the days leading up to this, there was already a number of changes that were happening. Our elections workers had been telling us, and the elections administrator had been telling us, that they were losing polling stations. Places where we normally conduct our elections were pulling their locations out. They said, we can't have that, and we don't want the spread of that into this location. So we were losing those polling stations. In addition to that, most of the workers who work our elections are people who are 50 and older. They are at the at-risk and the largest at-risk group, and of course that would put them in danger as our election workers. This is a time for cooler heads. This is a time for us to start acting smarter and not go so much on emotion. So we just decided as we went through this, and we've been waiting for directives from the governor and the Secretary of State, but all things that we have been given indicates to us this is the most appropriate thing to do to protect our citizens, to protect our election workers, protect the county and the exposure that might exist to the rest of the county by those election workers being in the presence of, on an election day in the middle of a health crisis like this is. So that is the biggest change that I've got to announce this morning. So when you don't go to the polls on election day, you can call me if you want to. I'll be glad to take your phone call. I'm taking them all anyway. So I want to thank everybody once again for your participation. I just cannot reiterate enough that distancing works, okay? Keeping out of large crowds works. We got a lot of folks out there that are following that, and they're doing a great job. This is one reason we have the numbers that we have as low as they are, but we do anticipate they're going to get worse, and we'll hear more about that coming up here in just a moment. But once again, thank all of you very much for what you do. We appreciate everything that you do, I assure you.
Good morning. My name is Brad Holland. I'm the CEO at Hendrick Health System, and it's good to see everybody this morning. I want to start by thanking the county commissioners and the city leadership, Robert Hanna and Anthony Williams and the judge and Commissioner Statler. Thank you all for the collaboration that we continue to work on. My colleague and friend Mike Murphy at Abilene Regional Medical Center and myself are working very closely on looking for what the community needs as this virus spreads through Texas. I am happy to report that all statistics appear that Texas is flattening the curve, but it also appears that what we're doing in Abilene is flattening the curve. So what we have advised the city and the county is that what we're doing is working. We are very supportive of extending these guidelines because what we're seeing is there's approximately 40 to 45 positives in the county at this point, and that is a 7 or 8% growth rate from the first case on March 24th. Unfortunately, there is a growth rate, and it will continue to grow. And what the hospitals are doing, working in partnership with the county and city, is modeling what that looks like. We know that the hospitals are open for business, and we do have capacity to treat this virus in people with symptoms, as well as all the symptoms that need hospitalization for unforeseen circumstances, because we're still open for strokes and heart attacks. But that doesn't mean we have endless capacity. So we do continue to need your support in what you're doing. We also recognize that we need a viable economy, and we continue to support buying local and supporting our local shops and vendors and restaurants, which is why at the hospital we've stopped internal catering, and we're using all local restaurants for all services that we continue to have. We are also having a no visitation policy, just like the jails. That is a governor mandated. That is very difficult for families and loved ones. At the hospital, we are following the CDC's guidelines, which basically encourages use of masks. And it's not because masks keep me safe. By me wearing a mask, it keeps you safe. In a hospital, we are more susceptible to COVID-19 maybe than anybody because we are around it more than most. So at the hospital, we are requiring all personnel to wear a mask at any point in time. That means if you work in the ICU, in our coffee shop or the gift shop or environmental services or administration, you will be wearing a mask. This mask is one that was donated from the community. And so whoever sewed this nice denim mask for me in administration, I appreciate what you're doing, and this may have kept you safe if I come in contact with you. So thank you. I'd also like to talk about the hospital here at Hendrick, and we have seen about a 50% decrease in the volume. If that is when the governor required us to cancel elective surgeries, we started closing outpatient facilities and reducing volume to free up PPE, as well as staff to meet a potential surge. I use the word potential because at this point we don't know, but we are ready to meet that need if it should occur. With that, we get lots of questions about what the hospital is doing with our employee staff. First of all, I'm proud to report that every employee, regardless of what sort of patient you're treating, COVID or non-COVID, we are requiring full PPE, masks, face shield, the works. That is because we don't have the bench strength in our organization to have our employees get sick. So if you come to our hospital, regardless of your diagnosis, because it has been determined that you could be asymptomatic, we are requiring all of our caregivers to treat you as if you are COVID-19, because that is what we're going to do to protect the employee workforce at Hendrick. That is something that we're very proud of that we've been able to do. We've been able to do that through generous donations from the community, and we'll continue to do that. So if there was something that I could ask from the community, it would be to continue to bring and sew masks. That's something that allows us in non-patient care areas to continue to wear, and that allows the formal medical PPE to go to the caregivers and keep them safe. We know we're early. With 40 diagnoses approximately in this county, this is the time that you're going to be able to prevent a surge. And so if you look at timing perspective, this is the time to double down on what you're doing today. With 40 community virus patients out there, there's presently 8 in the hospital, 1 in the ICU, and 7 on a designated floor to treat this virus. We have about 6 test cases pending, and we often get asked What is the ages? And I can tell you at this point, the ages in the ICU are around 60 years old. They do have comorbidities, but again, it just demonstrates that no one is immune from this. Financially, Hendrick Health System is in good shape because of the conservative nature of our board, but this is taking an economic toll on Hendrick as well. With 50% of the volume decreasing, that is a financial hit. So healthcare is not immune to the economic challenges that each of you are facing in your business. The Board of Trustees and administration have made a designated effort and communicated this housewide that we are not going to lay off staff or do furloughs at Hendrick. Now, there is chances, and most likely people will have reduced volume if there is reduced work to be done. So there is a likelihood of reduced hours and reduced pay at Hendrick. But we are making the designated effort not to lay people off or do furloughs because as a leader in healthcare and a conservative business, we've had that, we've been fortunate to be able to do that for an extended period of time. How long this virus takes, we're not exactly sure. No modeling has been successful in identifying what that is. I am happy to report that it seems to be working, what we're doing in Abilene, and this is not the time to let up because we hear in New York that the peak, quote, may be over. It is apparent that Texas lags, and how far and how much that is going to be up to us as patrons. I encourage you to use the face masks, not for yourself. Again, it's because you are respectful of the people around you because you may be a carrier unknowingly. I'd also like to talk about our flywheel. This is our COVID treatment and screening protocol. If you or a loved one have any concerns, we encourage you to call the COVID line. You will go through a screening tool. And what we're seeing in this market is it's not about travel anymore. It is community spread, and that is the bulk of what we're seeing. You will call this line, it'll screen you, and then we have staffed a 24/7 hotline, and you can talk with one of our caregivers, and they will direct you to the appropriate screening location for flu, strep, and potentially COVID-19, and direct you with quarantine instructions or direct you to the nearest care setting. We at Hendrick have started doing in-house testing. Up until a couple weeks ago, we were using and dependent on third-party labs that the labs may have had anywhere from 2 to 7 day turnaround. And as the labs got busier, the turnaround time extended. I am very proud of the lab staff at Hendrick working proactively. We have a machine called Beck & Dickinson, and that machine now has us the ability to have collection kits where you swab, as well as the test kits that we can run on that machine. We are now running about 20 tests in-house a day. So at Hendrick, we're able to control our own ecosystem. We're able to screen you, we're able to swab you, and we're able to get test results within a day. And if you need hospitalization, we have the capacity and the safe staff to treat you. Thank you for your time, and best of luck to everybody.
Good morning. Thank you all for having me here. My name is Mike Murphy. I'm the hospital CEO at Abilene Regional Medical Center. And I want to thank the mayor and the county judge and commissioners and especially my longtime friend Brad Holland for working so collaboratively on this health crisis as we face it. And so I'm a hospital CEO, so I recognize the focus of my job is to prepare for as best we can the COVID-19 crisis when it hits Abilene. I do recognize, though, I think we all recognize that the challenge that the leadership at Abilene and Taylor County and the state and national government have, their challenge is to balance the economic hit that will be incurred or is being incurred by shutting down restaurants and countless other businesses and the impact that has on the local economy, to balance that with the absolutely certain, in my opinion, increase in COVID-19 patients if those restrictions are lifted or even relaxed too much too soon. So I'm supportive I respect the decisions they have to make, but I do want to, as Brad noted, continue to flatten the curve and extend it out, and if we can, to the extent we can, push out whatever surge that we get. It's clear that we're going to lag New York. I don't know when that's going to be, but the longer that we can push that surge out, the better prepared we can be. Like Hendrick Medical Center, Abilene Regional is prepared to take on the patients. We have, just to give you a snapshot, the numbers are very fluid, but the snapshot for us this morning is we have 6 patients in-house in our COVID unit. 2 are positive and 4 are pending results. As Brad noted, the testing turnaround time has gotten a lot better. We do not have the ability to do that in-house, but the turnaround time for our testing has been shortened from probably an average of a week to 2 or 3 days. We do look forward to collaborating more with Hendrick Medical Center when they get completely up and running with their in-house and have the capability to handle our testing volume. We'll collaborate with them on that as well and have it self-contained in Abilene. We look forward to doing that. Our focus in the next days and weeks ahead is to continue to look at the shortage areas. ICU, the things you hear about the PPE that we're trying to conserve. There's definitely a nationwide shortage of PPE and of ventilators, although I think we have that covered. Of beds, we're working right now at Abilene Regional to open our 5th floor that's been closed for a few years, and we're looking at steps beyond that. Where else could we put beds if we needed to in the community? And we had a good meeting yesterday with the county commissioners and the mayor on where those options might be. We'll continue to work on that. We do think that we're fairly well prepared, but we'll take advantage of the days and weeks ahead to continue to prepare to try to do the best job we can when that surge hits. I want to thank the community for supporting us. I think the county judge mentioned the complaints about not being able to visit prisoners. We have the same complaints. Hendrick and Abilene Regional are both severely restricted visitor access. That's for the patients, that's for our patients, that's for our employees, and it's for the public. And we'll continue to do the things that we need to do to try to make our place as safe as possible. I want to thank you all for everything you're doing. I want to thank a number of community agencies and folks who have brought us not just PPE, not just masks, but food over the last week. We've gotten hundreds of pizzas and other meals. We continue to buy meals from our local restaurants when we can for in-house meetings, but we do appreciate the outpouring of love from our friends and neighbors in Abilene. Thank you very much.
Well, good morning. I appreciate you all tuning in. I'd like to reiterate some of the things that the folks before me have said. I think our community continuing to participate in social distancing, washing hands and observing your hygiene, limiting your gatherings and obeying the ordinances, the directives that we've gotten from our city leaders and our state officials as well is helping. Projections on this are all over the map, and so nobody knows exactly what will occur, but in part that's because it depends on what our community does. And what our community is doing right now is certainly helping to broaden the peak of a potential surge. By broadening that peak, it allows us to maintain capacity to care for the folks that come in who need attention, who need medical care. Along the lines of being able to care for folks is the issue of conserving our personal protective equipment. The governor enacted an executive order that postpones or delays all elective procedures. That's something that was put into effect to preserve PPE and also preserve hospital capacity. I know that's inconvenienced a lot of people in our community. It's something that we take very seriously, and both hospitals have set up ways to determine the urgency of a surgery and whether or not it's acceptable to proceed. That's determined by a group of physicians and is led by physician discretion. If you have any questions about a procedure or surgery that you had planned but has been postponed, I would encourage you to reach out and contact your doctor to discuss that. But that is, we realize the inconvenience, and again, that was put into effect by the governor in order to conserve PPE and hospital capacity. As far as the process at Hendrick, many things have taken place to provide for patients that come in needing to be evaluated or cared for. And you've heard about these before if you've tuned into other press conferences or read about these things through different avenues, that we've tried to communicate the things that are going on in our community through our hospitals. From outpatient screening clinics to patients that are sicker that come into the emergency department needing evaluation. Processes have been put in place in order to protect those that are there for other needs and to care for the ones that need to be evaluated and receive medical attention for a viral infection. We have a dedicated floor where these patients are cohorted to separate them from all others, and are doing everything that we can to keep all of our patients safe. As well as keeping the patients safe, one of our big priorities is keeping ourselves and our staff, our co-workers, our nursing staff, all the caregivers in the hospital safe as well. And that comes down to using proper personal protective equipment, as Mr. Holland outlined. We've taken measures based on CDC guidance to care for everybody in the hospital, patients and staff alike. And we will continue to do so. We keep reviewing our processes, our policies, in order to stay up to date and provide the best attention and care possible. We're continuing to prepare for the worst possible scenarios. As I mentioned earlier, the projections are all over the map. I think we look at the most concerning or worrisome projections and prepare as best we can for those, but continue to pray for the best possible scenarios. And by doing the things that we are doing as a community, I think we are much more likely to see that best case scenario. Finally, I'd like to thank our community. There's a lot of folks that have reached out to try to provide things that we need at the hospitals and in our community by offering up prayers. I know a lot of people gathered in the parking lots at both hospitals to pray for our staff, for the physicians, the nurses, the patients themselves, and I would encourage you to continue to pray. The power of prayer cannot be underestimated. And other things that have happened, Mr. Holland mentioned the masks that have come in. I know a lot of people have begun producing masks at home, seamstresses, folks that are finding ways to contribute to the health of our population, and that is appreciated and encouraged, and as well as businesses and other people in our community using their resources to provide face shields. There's all sorts of initiatives taking place through different community members that is greatly appreciated. And I just wanted to thank you all very much and encourage you to continue to work as a community to help us all do that as best we can through this situation. And I'll leave you with this. I want to be sure that you, our community, is reassured by the fact that our county officials, our city officials, and the healthcare entities, Hendrick, Regional, and all of our colleagues are working together to provide the best opportunity for our community to weather this, get through it, and take care of the folks that need the care due to this virus. Thank you.
Good morning, everybody. Today we've heard from our mayor and our county judge, our hospital CEOs, Dr. Lowry. They provided a message of hope and of calm. We are working together, and we will get through this. And many of us are making sacrifices to help others, and this is needed and appreciated. And Dr. Lowry went through a list of some of those things, and I appreciate you highlighting those. That was It's good to celebrate the things we're doing as a team and as a community. The Abilene Police Department has begun to actively enforce the city's local order. I receive daily requests from business owners asking if they are essential, and we're going to try to answer those to the best we can in a timely fashion. I also receive information from citizens reporting what they believe to be a violation of the order. And some of the most recent reports we've received turned out to be rumors. One of them included a bar. People thought that the bar was open in the middle of the night, and perhaps people were parking in another parking lot and walking over. And it turns out that the bar owner had a construction crew in his building, and they were repairing and maintaining the building. That's perfectly allowed by the governor's order, and there's nothing wrong with that. One business was mistakenly operating under the assumption that they could. It was an honest mistake. They had read the rules and they had made some interpretations. They just made some wrong assumptions. But we've worked with them and talked to them, and they've very quickly and voluntarily complied with our requests to follow the local order. So far, for those we have visited with, they have come into compliance, and they are working well with us, and I really much appreciate that. There are also businesses, like tanning salons. Some of them are mistakenly remaining open. These types of businesses need to close, and we will be visiting with you soon to discuss compliance of the local order. I also want to mention the city will be issuing further information on what is and what is not open in the very near future. We don't intend to close additional businesses at this time. We want those who have been asked to close to be fully informed and to comply with our requests. In order to facilitate the public's health, safety, and welfare, I'm announcing today that tennis courts are closed effective immediately. I've read some research that indicates coughing on a tennis ball may actually spread to another participant, and so we just want people to be safe. We're also having problems. I think last night we had some problems with people congregating in the tennis courts, and it created problems for our police department, although they dispersed when asked. We just want to avoid opportunities like that. So effective immediately, I'm closing the public tennis courts. I also want to remind everyone that basketball courts are closed. Playground equipment is also closed, and people must use social distancing while recreating at their parks. Please don't congregate in groups of 10 or more. If you're sick, stay home. If you're an employer, please extend grace to your employees during this time. We are a community rooted in service above self. I love this community, and I know we will get through this. And together, we will overcome all things. Thank you for your time. Mayor, I'd like to turn it back to you for some final comments.
Hope you can appreciate the effort and the collaboration that's taken place, and hope you feel confident about us moving forward. We want you not to panic because we are indeed prepared. Additionally, there are also, Mr. Chairman mentioned some follow-ups, but also some larger entities in the city that did have some infections there. Feel very, very confident about procedures being put in place to be sure they are compliant so we don't have a spread there. We do have some time for a few questions. Before we get back to work on behalf of this community, are there any questions of any of those who presented this morning that we can entertain for just a few minutes?
Mayor, can you talk briefly what led the council to decide to delay the May 2nd vote?
Well, of course, it's been very, very fluid. We've been in contact with the governor's office as well as the county and others, and certainly we don't want to increase the risk and look at some projections that may have to surge during that time period. We can put politics aside and focus on what's best for this community. Don't know what date that will be, but it won't be May the 2nd. Any other questions we have?
Is there a way we could get Mr. Murphy to discuss or address any furloughs or work shortages or anything like that within this hospital?
Good morning. The question was about furloughs.
Or any other workload reductions or anything like that?
Yeah, so I guess for the most part, we're pretty much in step with all of these things. With what Bradley Holland said for Hendrick, we're trying to avoid furloughs wherever we possibly can. We have had to. We closed our ambulatory surgery center, or ASC. We pretty much closed our cath lab. As Dr. Lowry noted, elective surgeries, many that are semi-urgent are being pushed back, cath lab procedures. So a lot of those employees are being deployed elsewhere in the hospital, everything from screening at the front entrance to working in other units. The goal is to try to keep everybody employed. The last-ditch goal before a furlough would be to give them at least enough hours to cover their benefit costs, their payroll deductions for benefit costs. So we've had a few people that are right now this week, we're going through some discussions to see if they're willing to work elsewhere, or they may end up being furloughed for some period of time, and they are for the most part in our clinics for our employed physicians at this time. Nobody in the hospital has been furloughed. Thank you.
Any further questions at all from the media?
Judge Bolles, can you briefly talk about what local municipalities are still discussing holding their elections and which ones are not?
I have a meeting scheduled this afternoon with folks from GymNed. They have a bond issue coming up on May the 2nd, so we're still working with them. Again, as I did point out, the municipalities themselves are the ones who schedule these elections. They contract with the county, and so they can hold their election if they choose to do so, but they won't be using county election machines and county workers and things like that to do it. We're not going to put those people at risk.
Is GymNet the only one municipality that is considering?
As far as I know, they're the only one that still is, and they're meeting tonight, I think, to make that decision. So at the present time, it's still on the table, but at the present time, you know, by this time tomorrow, it may be completely different. And everybody, I want to say just again, so much of what we have put in place here and what are in place now rely very heavily on voluntary compliance by the citizens, okay? They know the dangers, and they see that. I think that's one reason why we get phone calls as elected officials when people report what they perceive as violations. And we have an obligation to follow those up, be they out in the county or be they in the municipalities, in the cities. But the citizens themselves understand the danger of this, and they have seen the pictures that are coming out of the East Coast, and they can see what can happen to a city. This is spread person to person, and that is why we have the rules in place, and we'll enforce those rules to keep people from getting in proximity to each other and perhaps inadvertently spreading the disease. And so that's kind of where we are. And again, I just want to say thanks to all the citizens, because they do get this, and they're very serious about this, as we are. We will make it through here, but we're going to have to really work together and follow the rules, whatever the rules are. So just want to pass that on to everybody, and thanks again.
Brian?
Yeah, this is just a question that we had about how some of the numbers are reported. There was a woman from Brown County who was their 6th case. She was in her 60s, but she tested positive in Hendrick and was hospitalized there, so we're confused as to...
Well, reporting-wise, it goes back to where that county, where the person's home county is. And so she may have been tested in Abilene, but she's from Brown County, so it's part of that number. But before we conclude, I'd be remiss, I think, that both Mr. Hanna as well as Judge Pro Tem Stadler would both concur that Dwayne Bush and Vincent Cantu have just done an outstanding job in regards to the emergency response and all the drills and conversations taking place. We have planned for the very worst scenario, but we're praying for the best, and I feel so good about all the leadership involved. Thank you for your time. Hope this was informative. If need be, we will communicate again with you, but we want to leave the message that we are prepared. Thank you very much, and you have a nice day.